Hey, everybody. Welcome to Black Health 365. I'm Kenya Brown. And did you know that Black Americans are at a higher risk for serious health conditions? They are more likely to be diagnosed with heart disease, cancer, and diabetes and face a greater risk of stroke compared to other racial and ethnic groups. April is National Minority Health Month, a time to create awareness about these disparities and promote better health outcomes. Joining us today to discuss the health challenges affecting African Americans is Dr. Gregory Hall, an internal medicine physician at University Hospitals. Hi, Dr. Hall.
Hello, how are you?
I'm doing well. You always have some great information for us.
We'll see how we do today.
Okay, we gonna see, all right.
All right.
And make sure you guys share this video so that other people can get all this great information, okay? Because we need this, all right. Now, what are the key health disparities that disproportionately affect Black Americans, and what factors contribute to these issues?
Well, as being Minority Health Month, I mean, they call it Minority Health Month, but really it should be African American Health Month because we have all the bad information. We're the ones that have the worst cancer risk for prostate cancer, highest death rate for breast cancer, and prostate cancer, lung cancer amongst African American men, and so we have the worst outcomes. And so, at this point, this month is a good day to kind of bring attention to how we can kind of get control of that. We have just so many more, 70% more chance of getting Black men like me getting prostate cancer. We have the ultimate health disparity is breast cancer occurs more in white women, but it kills more Black women. And so that's, how can something occur more in one population yet have a higher mortality in other? Welcome to America, right? So, but
Wow.
that's where we have to kind of be proactive, and we really need to take control of our health. And I think that's kind of the take-home message I want to drive home today.
So, take control of our health. In what ways? Why are we specifically being affected more than other ethnicities?
Well, some of it's, if we address like the part that we can control is like our attitude toward things. So I always think about my father said, if something's wrong with me, I don't want to know. If something's going to kill me,
Mhm.
good. I'll be dead. Good. Right. Those are
Right.
his attitudes. But that culturally is kind of how we kind of, that's kind of in my core as well. And I have to kind of reject that. If something's wrong with you, we need to identify it early so that we can fix it. And we do that with everything else in our lives. If you've got a little leak in the roof, you fix it early. If you wait, it becomes a disaster. If you have a little something wrong with your car, if you fix it early, you can keep the car forever. If you ignore it, you're going to have to get a new car. So we know how to apply, changing the filters in our furnace. We know how to do all those things as it relates to everything else. Even our children, we're proactive about making sure they stay healthy. But when
Right.
it comes to ourselves, we put ourselves last. And we really can't take care of our homes, our cars, our children, or our families if we don't first take care of ourselves. And so that's the key. And really, that's, screening for cancer. If we can find cancer early cancer is always easier to cure than late cancer, right? If we
Mhm.
find heart disease early, we can do things about that. If we can prevent a stroke, that's better than treating a stroke, right? So that's like, buy a blood pressure monitor. We've talked about it before, Kenya. Everyone should have one of those automated blood pressure monitors at home, in their kitchen, on the dining room table, all at the ready to measure random people's blood pressure. Get the one that goes on your upper arm, not the wrist, because the upper arm is more accurate. Feel on the ground, calm, check your blood pressure. Know what your blood pressure is. The higher your blood pressure is, the higher your stroke for heart attack, stroke, aneurysm, sudden death. And that's what's killing us, right? So get a blood pressure, get a blood, excuse me, get a blood pressure machine and use it. And don't, people used to come to me and say, oh, it's just high because of my weight code, or it's high because I don't like doctors or whatever. Well, stay home and check your blood pressure. But if it's
Right.
high, let me know. And then we can put you on some medicine for that. Same thing with annual mammograms, getting an annual PSA to screen for prostate cancer. No more rectal exams. You don't have to be traumatized by me I don't have to be traumatized by the procedure. It's a
Right.
blood test, right? So get your annual PSA. Black men are the highest risk for that. So just being proactive. Early prostate cancers easier to cure than late prostate cancer. Early breast cancers easier to cure than late breast cancer. Same thing with colon cancer. We got Cologuard, we got colonoscopies. There's ways to screen for colon cancer that are less traumatic, and early colon cancer is easier to cure than late.
Listen, see, the doctor just said a whole bunch, but what he didn't say is that it was expensive. This is about attitude. This is our attitudes that we've carried on for probably generations. I remember, those attitudes. Don't get you better not get in that ambulance because that's going to cost a certain amount of money. Or, we were reluctant because of lack of access to health care to go and really check those things out early until something was really falling off. Then you could go to the doctor. But how do social determinants of health, such as access to healthcare and nutrition, impact the health outcomes of Black Americans?
Well, and you touched on it. A big social determinant of health is how much money you have to do things with, whether you have transportation to go and get a colon cancer screen or to go and get a mammogram. And then if they take your insurance, does the insurance pay for the whole thing? And so a lot of these screening things, when you go, it's been designed that if you go for your annual preventative visit, that's supposed to be covered, whether you have Medicaid, Medicare, or private insurance. Your annual preventative visit is supposed to be covered without a copay, right? And then whatever I order, or a doctor like me orders at your annual preventative visit, is supposed to be covered. So if I order a mammogram, a colonoscopy, or whatever, it's supposed to be covered completely without a copay. And if they now, sometimes they're going to charge you a copay, and that's when you bring it to their attention that no, this is all part of my preventative visit. So everyone should at least go for that one free preventative visit and get those. If I ordered a pneumonia vaccine, people with asthma or COPD, during that preventative visit, supposed to be covered. So that's, money is a big deal, and I know it's out there, but
Right.
again, we make sure we change our oil. I mean, no matter what oil,
Yeah.
you're gonna lose your car if you don't change your oil. So
Yes.
it's an expense that's built in. Everybody's gonna have a turkey on Thanksgiving. Everybody I know, right? It's an expense. Doesn't matter how much they charge. We're gonna have our turkey, right? So
Yeah.
it's just include your health in that expense, and you'll
Absolutely.
accept it much better,
Pay now or pay later. Pay later. Yes.
right?
Health is wealth. So let's break it down. We got the assignment, Doc. Now, what steps can individuals take to reduce their risk of developing conditions like high blood pressure, diabetes, and heart disease?
Well, I think everyone should have their own primary care doctor. And so if you think to yourself, who's your doctor? I know all of my patients know I'm their doctor. Dr. Hall's my doctor. What I mean?
Yes.
I'm the number one doctor in their lives. And you should have a number one doctor in your life. And it shouldn't be your surgeon, you know what I mean, or
Yeah. Oh,
your
yeah.
GI doctor. It should be a primary care doctor who's looking at all of the things that are involved as it relates to your health. So, I mean, if you can't think of the person that your doctor is, then that's where you need to start. That's your project for Minority Health Month. Get a primary care doctor, right? So that you can engage, you have someone you can depend on, you can ask them questions, you can talk about your family history risk, because genetics is so important. So whatever your mother or father or grandmother, grandfather, or brother or sister has or had, you're at an increased risk for it. So don't stick your head in the sand. If your brother got colon cancer, that's not him. You need a colonoscopy faster than the rest of us, right? And so
Right.
we can start talking about those things during a preventative visit, so that we can kind of find out what you specifically are at increased risk for, and kind of be proactive that way.
Absolutely. Listen, got to get that early detection. You want to take care of yourself. It is so important for you to take care of your body. You only get one. And so you got to be very proactive in taking care of things. Now, how can you find a doctor that you trust or to help address these disparities, improve these health conditions?
Well, I mean, there's a lot of my patients, just being transparent, probably 9 out of 10 out of my black patients Google black doctor, right? Because they're looking for a doctor that I'm from Cleveland. I grew up off of St. Clair. They had a similar experience so that they can understand their family, understand I grew up eating fried chicken, eat it still. You know what I mean? So
Yes,
it's not a
absolutely.
you don't have to deal with any cultural differences where someone's looking at you crazy because you said something that's very commonplace, at least in our community. So if you want a black doctor, look that up. I mean, there's nothing wrong with doing that. I'm sure there are other people of other races that prefer people of their culture in order to be most comfortable, because it's a very vulnerable thing to come to the
Yeah.
doctor and tell them about all my little private things. If you need to be
Right.
comfortable with that person. If you want a man, some black men really want a man. You know what I mean? They're not comfortable
Yes,
talking about erectile dysfunction with a woman. So, I mean, whatever
absolutely.
your preference, and women like women as well. You know what I'm saying? So, whatever your preference is, look for that and see if you can find that, and then or something close, and then then kind of go from there. But I have white patients, I have East Indian patients, and they love me. And so it's not like you have to have a black doctor or anything to do that, but find someone you trust and someone you like, and so because you need to have that person kind of at the ready if something goes wrong. If you go to the hospital, if you go to the ER and they say follow up with your doctor, well, I don't even have a doctor.
Yeah.
These are the reasons why you need one.
Yeah, it's really the first step in advocacy for yourself, for your family. You definitely want to find a doctor that you're comfortable with, comfortable talking to, because you're probably more likely going to follow their instructions. You're more likely to share the things that are going on with you, and more likely to come back and follow up as well. Now, what role does preventative care play in reducing health disparities, and how can Black Americans be encouraged to prioritize regular checkups and screenings?
Well, we are gonna have to be deliberate about it. So, my birthday's in July, and so the week of my birthday, I take the week off because it's summertime in Cleveland, right? And it's my birthday. But I also make sure I get my annual visit, and I make sure I get my blood drawn, and I make sure I do that as a birthday present to myself, so that I can make sure I can continue to have birthdays, right? And so I think you really need to figure out a time, and I had to be intentional, because if you don't, I put it around my birthday because I can't remember, when did I do this? I
Right.
can't remember when I went to the dentist last. I know I went, but I couldn't tell you what month. But I know when I went to see my primary care doctor, it was in July, right? And so that way I know when this July is coming, I know I'm going to celebrate my birthday, and I'm also going to go and get my annual visit. So maybe attach it to something, or attach it to your mother's birthday, or your father, whoever your favorite person is, and say that I'm going to figure out a way to be deliberate about all of my preventative care things. And then I go into the doctor saying, I really say a little prayer, Lord, help me. I'm going to do whatever this man says. What I mean? I'm not going to double think it, because I'm a doctor too, and I'm a primary care doctor. And he suggested things that, frankly, I didn't think I needed. But it's annoying as the doctor. So I'm like, I don't think well, I'm trying to be your doctor and give you the best advice. Right. So, tell yourself, let me be open to whatever it is they suggest. If you have high blood pressure, be at least open to discussing blood pressure medicine rather than barking out, what are the side effects? I'm going to have side effects. I'm a sensitive
Yeah,
person. Think of, kind of meditate to yourself. Let me go in here with an open mind and an open heart, and with the goal of trying to get better. I think that'll help sort of the interaction when you come in, so there's not a lot of tension going on.
absolutely. Now, you definitely want to be open, but if you feel that you're being misunderstood, feel free. You got to ask those questions, because they might be misunderstanding something that you're saying yourself. So make sure you share this video. Lots of great tips for us to get started. We need to get started on a path somewhere, y'all. So Dr. Hall has given us a lot of great information. Make sure you share this video. And thank you, Dr. Hall, for joining us today and shedding light on the health disparities affecting our community. As we wrap up this segment, I encourage everyone to prioritize their health by finding a trusted primary care provider. Call 216 714 2397 to schedule an appointment today. To learn more about our Black Health 365 program, visit wzakcleveland.com/BH365. Thanks so much, Dr. Hall.
Thanks so much for having me.